Sorry, I'm new to this. Thank you, Mr. Duffy, Mr. Cleaver, for the opportunity to come here and speak. This is a conversation we have on a local level, so I'm happy to be able to be here in front of a larger audience and to see that a lot of the things I'm seeing locally are also agreeing with Ms. Lilly's community and Ms. Bremer as well. I'm the director of Northwest Community Services Agency. We're what's called a community action program. We've been providing services to low and moderate income throughout our 5-county service area for the last over 50 years now. As we're community action, we do prioritize vulnerable populations, low-income populations, and unfortunately, for our service area, homelessness is a large part of that world. On the local level, as homeless service providers, we work well together. We work with our school districts, we work with our local units of government, our Head Start agency, our faith-based partners, and we truly pull together a toolkit to try to accommodate those needs. From a geologic perspective, my service area covers 8,000 square miles. In that 8,000 square miles, we only have 90,000 people. We probably have more trees than we do population. Our agency has served as the lead in terms of the HUD world, the ESG world, those sort of things, and it predominantly has to do with capacity and the requirements that come with receipt of those federal funds. We, in the city of Superior, are fortunate that we have 3 shelter facilities. We have a homeless men's shelter that is operated by our organization. We have a family shelter that's operated by one of our faith-based partners, and then we have a domestic violence shelter. In Ashland, which is 70 miles away, we also have a domestic violence shelter, but that is it. Throughout the rest of our service area, we're relying on hotel vouchers to try to prevent individuals from sleeping in their cars, sleeping in the campsites. It's cold, it's 40 below. Anybody that we can get sheltered on our point in time counts, we bring our faith-based partners, they issue hotels. The reason I bring this up is related to some of the point in time data that's been discussed, is a lot of our homeless numbers are based, and the homeless needs going up and down are based on those PIT numbers, and they're also based on the HMIS data. And for our service area, to try to go out and cover that 8,000 square mile area between 11 at night and 6 in the morning, finding people that are living in campsites, we have 2 reservations that we need to cover, those numbers aren't truly accurate in terms of what our community looks like on a given night. In terms of the homeless information database, which is a requirement with HUD, our organization, along with our family shelter, are the only 2 organizations that are entering data into that system. So if we were looking at, from a community level, what the homeless needs are of Northwest Wisconsin, and the numbers going up and down, it's not reflective of 50% of our shelters because of domestic violence. It's not reflective of our faith-based partners that are providing services. And as we've discussed earlier, it doesn't include the number of homeless identified through our school districts and our Head Start agencies. One of the things that this bill would allow would be local flexibility. In our service area, our needs are similar in terms of the families, people that are being placed in foster care, the families that are doubled up because there's no shelter availability. The continuum of care process, while it's important and it does fund a variety of services in our country, I believe looks very different in our part of the country than it may in some other parts of the country. I provided a lot of written testimony, so I'm trying to focus my oral on things that may be a better use of your time. But in the state of Wisconsin, we have 72 counties. HUD recognizes 4 continuum of cares. So our bigger cities, Racine, Dane, which is Madison, and Milwaukee, HUD designates those as their own continuum of care. Our northern 5 counties is what's called the balance of state continuum of care. So on the ground level, there's 21 local groups, myself representing my 5 counties, Dewana Bremer that was here a few weeks ago representing her service area, but we comprise what's the balance of state continuum of care. So as this process started many years ago, I've been involved in this process for 21 years, the continuum of care was designed to meet homeless needs. There was a pro rata need that was established by counties. We started a lot of supportive services only programs, transitional housing programs, things that were identified locally as a need. As this evolution in time has changed, the only new programs that communities are able to apply for is permanent supportive housing. And in our case, we don't have enough chronically homeless meeting that definition in our rural areas. And what's been happening in reality is we've had larger cities that are having more services available for chronic homeless, which is great. That's their need. People are being housed. But what we're doing is we're continually taking away services from our rural communities, and we have less services available to meet the needs of the families that we're working with. So I do see I'm over time. I will pause there. I'll be available for